Every week, The Nuance will go beyond the basics, offering a deep and researched look at the latest science and expert insights on a buzzed-about health topic. Alzheimer's is an incurable brain disease caused, in part, by the accumulation of destructive protein plaques and tangles. These plaques and tangles choke the life out of one brain region after another, causing them to shrivel up. Drug companies and research institutions have poured hundreds of millions into the development of effective treatments for Alzheimer's, but so far, they haven't had much luck. We have two classes of approved drugs that improve attention and memory a little bit, but they don't slow the disease process, says Dr. David Holtzman, professor and chairman of the Department of Neurology at the Washington University School of Medicine in St. Louis. There's really nothing you can buy, no pill or supplement, that will protect you. But some preliminary evidence does suggest that certain cognitive activities, notably, various methods of meditation, may forestall the onset of brain degradation and memory loss, or offer protection against it. There's empirical evidence that if you manipulate how you think, the outcome can be positive. A small 2016 study in the Journal of Alzheimer's Disease (JAD) found that 12 minutes of meditation a day could improve memory and brain function among people showing signs of age-related cognitive decline. The practice of meditation can modulate activity, increase gray matter volume and density, and promote functional connectivity in multiple brain areas compromised in Alzheimer's disease, says Kim Innes, first author of the study and a professor of epidemiology at the West Virginia University School of Public Health. How is that possible? Meditation may counteract stress-related changes in gene pathways that seem to contribute to the development and progression of Alzheimer's, Innes explains. Her study is one of many recent ones to find that the cognitive tasks you ask your brain to perform each day may play a significant role in your mental health and risk for disease. Researchers are tying mindfulness and meditation practices to a range of health benefits, from reduced symptoms of irritable bowel syndrome to relief from chronic pain. A 2015 JAD review linked meditation to a 43% increase in telomerase activity, which the review's authors call the largest increase ever reported. Telomerase is an enzyme that protects the structural integrity of DNA. Many major diseases, notably cancer, stem from DNA-related damage and mutation. And research on breast cancer survivors has shown that mindfulness-based interventions, by reducing stress, can better maintain DNA telomere health than standard forms of care. Other thought-focused interventions have even more evidence backing their benefits. Cognitive behavioral therapy (CBT) has emerged as the gold standard in psychotherapy and is considered to be one of the most effective remedies for conditions ranging from insomnia and tinnitus to major mental health disorders. A 2017 study found that CBT strengthened connections in the brain involved in processing social threats, and the effects can be long-lasting. There's empirical evidence that if you manipulate how you think, the outcome can be positive, says Dr. Marcus Reichel, a distinguished professor of medicine at Washington University School of Medicine in St. Louis. It's reasonable to think that the opposite is also true. That is, if you can think yourself healthy, you may also be able to think yourself sick. And if cognitive tasks like meditation and CBT, both of which involve sustained concentration, are good for you, it would make sense that those mental activities that scramble your concentration could turn out to be bad. You can probably guess where this is going. The research is preliminary, but there's more and more evidence linking multitasking behaviors, especially those related to our devices, with some negative health outcomes. A 2017 study from Germany found the heavy communication load associated with email, social media messaging, and internet multitasking was associated with higher perceived stress, as well as burnout, anxiety, and depression. And a 2014 imaging study in PLOS ONE found that heavy media multitaskers tended to have reduced gray matter densities in their brain's anterior cingulate cortex, a part of the brain involved in concentration and some emotional processes. None of this is hard proof that these activities are bad for you. Correlation is not causation, and anxious or depressed people may be more likely to spend lots of time multitasking on their devices. It would be an even greater leap to suggest that these multitasking activities, by promoting stress and anxiety, could also contribute to a person's risk for diseases like cancer or memory loss. But put all this research together, both the evidence linking certain activities to health benefits and others to harms, and a theme emerges: the tasks you ask your brain to perform likely have a major impact on your health. The mental effort required for your brain to concentrate may be akin to physical exercise when it comes to your physical health. And allowing your mind to continually flit from one task to the next may turn out to be the equivalent of sedentary time. A lot more research is needed. But it's time to embrace the idea that how we use our brains, or don't use them, plays a big part in our health.